Hi, I'm Dr. Khurrum Shaukat Yusafzai. Today's video is about the use of hyperbaric medicine in the open heart surgery, also known as cardiothoracic surgery, where the sternum, which is the bone here, is opened up and the doctor goes inside and he performs the surgery, which is also known as the open heart surgery. So in this open heart surgery, since the body is opened, there is a chance that the bacteria, which is all over the world, all over the human body, can go inside and cause infections. And there is a space behind the sternum, the bone, which leads to a lot of infection, and there is purulence, which means there is a lot of pus formation behind the sternum. And this leads to one of the biggest complications of the open heart surgery, that the person can die because of septicemia, which is infection in the blood, and renal failure, and many things. So the open heart surgery has a failure rate up to 33% because of this post-operative complications. Like, the people will not die from the surgery, but they will die from the post-operation period, which is also called in short as post-op period, where the infections can cause this complication and can lead to septicemia and infections, and this can cause death. The most common infections are these. As I showed you, the number of bacteria, which is very common, and the cocci bacteria, like the one which are found on the human body, can cause these complications. And there are other bacteria can also happen inside the hospital, because the hospital is the place where the germs are accumulated. And the problem with the hospital-borne infection is that they are resistant, because in the hospital every day antibiotics are being used, and because of the use of the antibiotics, these bacteria become resistant, and they're not cured because of the use of the antibiotics, which are the only tools available with the doctors, the surgeons, and the medical specialists, and the infectious disease control doctors. So this is a big problem, and because of this drug resistance, now they are actually using combination of antibiotics, that they will not use one antibiotics, they will use multiple antibiotics to cure you. And the chance of curing is still less, because maybe both of the antibiotics are resistant. So this is one of the biggest issue which the medical world is facing. And this is the reason of the increase of post-op complications, and many people are dying because of these kind of post-operative complications of the resistant bacteria, and the antibiotics not helping to control the infection or to heal the human body. So the human body needs healing, and that's where the hyperbaric oxygen therapy comes. So let me tell you about that. The hyperbaric oxygen therapy is a healing technology. So if after the cardiac surgery this is used and the person is treated in a hyperbaric chamber, he will be cured. He will be cured quickly, and his days in the post-op intensive care unit becomes less. So after hyperbaric treatment, usually the people are there up to 50 days to 60 days after the open heart surgery. This has been shortened up to 35 to 36 days, almost half, because of the use of the hyperbaric chamber. And this will also decrease the cost, because every day the patient is inside the intensive care unit, it costs a lot to actually keep the patient there. And the hyperbaric oxygen therapy is shortening this to almost the half. So this is like saving a lot of money. And a part of that, I would show you the results of patients which were treated after the open heart surgery in the post-op. So here are the results. As you can see, the results are marvelous. Every single one of the patient who was having open heart surgery and they had complications, these are the complications. So you can see that in spite of the complications and in spite of the resistant bacteria, in spite of all these odds, these people all survived the open heart surgery and they came out. So this is marvelous. And this is one of the reasons I am today advocating for hyperbaric oxygen therapy after the open heart surgery. So now you would understand that this hyperbaric oxygen therapy should be used after open heart surgery, and this hyperbaric oxygen therapy can save countless lives. And as you have seen in the results, that almost all of the patients had marvelous recovery. Their post-op time in the intensive care was almost reduced by 50 to half, about 50%, and they had no problem or issues with the resistant bacteria. So this is great, and this has led the doctors to suggest that in the future, in the open heart surgery, hyperbaric oxygen therapy should be used as adjuvant therapy. Adjuvant therapy means that you are doing the normal treatment and you add hyperbaric oxygen therapy to it. So it is a very good and best adjuvant therapy after the open heart surgery. Because in the open heart surgery, as I would show you, they open up the whole body. Like I would show you the pictures, like the people who actually survived and who performed the open heart surgery. You can look at the picture, how they look, and this is how their scars are. So hyperbaric therapy is also known to reduce the keloids or the scars. So after the open heart surgery, keloids is also one of the biggest complications. So these keloids would be reduced and you will have no scarring and the body would have a beautiful healing with almost zero scarring. And this can only happen if you have availability of hyperbaric chamber either at your hospital, and the hyperbaric chamber should be a specialized one which can take care of intensive care units. And there is actually a hyperbaric chamber which can take such patients, like it has all the emergency equipment inside. These kind of hyperbaric chambers are already present in America and Germany and Netherlands and some developed countries. And I can also assist you in providing you such specialized hyperbaric chamber in where the intensive care patients can go inside, the whole trolley can go inside. There would be like life support systems, which normally you find in the intensive care unit. They would be found inside the hyperbaric chamber, and the door is actually sliding. It's a quadro. It's like a shape like a room with the sliding door. The benefit of this is that the whole trolley can go inside along with the patient, along with the life support systems. And inside, those life support systems are actually special because they are actually made according to specification that they can also be used in the pressurized environment. And I would show you the picture of one of the such hyperbaric chamber, which is here. So these hyperbaric chambers are a bit costly, but they save lives. And in the past, I have a video on the like the use of hyperbaric chamber. Like if you see the world biggest hyperbaric chamber video is on my channel. There I would show you that in the past, actually, before the heart-lung machine was invented, the hyperbaric chamber would be used to put the, like the heart surgery patient would be actually put inside. Actually, they would perform the surgery inside the hyperbaric chamber, and then they would be there until they stabilize, and then they would be moved to the ICU. So this concept has been used in the 60s, like in the Boston General Hospital, where they were using it for the kids. And President Kennedy, the famous American president, had a son who was actually had some issues with his heart, and his surgery was done inside such hyperbaric chamber, but he did not survive at that time because of his congenital fault of his congenital disease of his heart. And so this is a famous case which people have forgotten because it happened in the 1960s. And recently people are again looking at hyperbaric chamber to treat the post-operative open heart surgery patients. And this would be wonderful if we start using it again. And the research article and the stats which I showed you actually proves that it is a wonderful idea. And I hope I can be helpful to the people who need it, and I can provide such hyperbaric chamber. I can also help in installation of such project. I can train the people, train the doctors, train the technicians, train the nurses, and I can do this project with my colleagues and my team. And I hope you have now understood about the use of hyperbaric technology in the open heart surgery. And I hope you like my video because I brought this video with a lot of research and a lot of statistics. And this is one of the world best hyperbaric channels. So I hope you subscribe to my channel and also like my video, and also leave some comments if you want to ask some question or information related to this video. You can leave the comments. So hope to see you soon. Take care. Goodbye.